Three, two, one.
So, hello everybody. My name is Dr. Paul Braadt. I'm a chiropractor with an orthopedic specialty. I'm board certified in orthopedics. I'm also trained in nutrition and rehabilitation. And I want to talk to you today about some of the basic CPG advancement program requirements for just general physical fitness. David Sanders and I have been talking about what it would take to be able to survive and to be able to help others in a type of environment that's hazardous or in some type of an emergency situation. So there's some just basic physical things I want to talk to you about: how to keep yourself safe, number one, how to do a stretching and conditioning program that's very basic, not necessarily training for the Olympics, but just some basic things that people can do at any age to be prepared to help out in an environment that's dangerous. So first of all, I want to talk about stretches. When you think about what your body does, it moves in certain positions well, and some positions you want to be able to stay away from. If you put your finger up like this and push your finger back to where it stops, that's called the end range of a joint. It's the end range of the joints we want to be able to avoid if we have to bend, lift, or twist, especially with weight, because that's when the spine is most vulnerable. So if you ever played sports, you know it's what's called a neutral position, where you're kind of moving, lifting, bending with your legs bent, so all the force and strength is in your legs and not in your back. So what we want to be able to do is to stretch the major muscles that allow us to move in safe directions. So the first thing would be to be able to bend forward. If you can part your feet apart and just let your body hang and just go slow all the way down and just let it stretch if you can. If you can hold at your end range for a count of about 30 seconds without bouncing. This is called ballistic stretching. It's been found to actually reflexly shorten the muscle. So if you can bend down like this, just hang, for example, to go down and stretch the muscles for about 30 seconds, that's good. The major muscles we want to stretch are going to be the hamstrings in the back, the quadriceps in the front, the thigh muscles in the front, and the calves in the back, and our back muscles in through here. So we can stretch the hamstrings that way. You can stretch, you can support yourself on something, pull the leg up like this, or pull with both hands and stretch like this if you like, to stretch the quadriceps in the front on both sides. Then a calf stretch would be two. Can you see that, David? So the leg is locked back like this to stretch the calf muscle, and then you stretch like this to stretch the Achilles tendon, holding each for about 60 seconds. When you want to stretch the spine, just bend to the side as far as you can. You get the upper body involved with this with your legs locked at about shoulder width apart. Just kind of bending like this to the side, holding gently at a range like this that's close to your end range. And then it's just a gentle spinal twist in one direction or the other, not going to the end and whipping. There's a nice controlled stretch like this, and then going forward and coming backwards, just gently stretching. The shoulders can be stretched by making windmills, nice and slow, nice and controlled in one direction and in the other. The same thing with the opposite side, one direction and the other. And that can be gently stretched by looking one way and looking up, looking down, nice and slow and controlled, looking up and looking down, and rolling the shoulders in circles one way and the other. Those are basic stretches that will prepare you for almost any activity. Now, to be able to strengthen the muscles you might need in an emergency, let's think of what you'd have to do in an emergency. You have to be able to bend, pull, and push. So these are basic exercises that are in the CPG advancement program, which you probably all have a copy of. So if we want to be able to use the strength in our legs, we need to be able to squat. So if you can put your feet on the floor like this and squat down with your heels on the floor as best you can. This is a position that allows you to get the maximum stretch in the buttock and thigh. Also helps to stretch the knees, and you're keeping the heels on the floor. If you can't do that, you can go down like this, keeping the heels up, just to stretch as far as you can. So to strengthen the quadriceps, the easiest way to do this is to do a squat. You can do it right to parallel to the floor like this, or if you're real aggressive, you can go all the way down like this and come back up. That's the one repetition. And if you did 10 of those a day, or with hand weights, you would strengthen up the muscles you would need to be able to lift and bend with in case of an emergency. So let's think about that. Other things we have to do. We have to be able to push. The easiest way to push would be just to do a push up. For example, you can do a push up. The idea is to bend the back up a little bit like this, and to push up as far down as you go comfortably, and then back up again. That's a standard push up. If you work up to about 10, 20, 30, 100, this way you'll be able to really improve the strength of the muscles that push. Let's think about pulling. How can we pull? Well, there are pull-ups, for example. If you can't do pull-ups, what you can do is put a bar in the jamb of the door and step up on a stool and pull yourself up like this and just come off the stool and just let yourself down. They're called reverses, which allows to be able to strengthen the muscles underneath the arms and the biceps. So those are very, very basic that you can do. So we push, we pull, and we squat. Now there are basic exercises. I'm going to take this to the next point, like going to the gym. All we would need to do is squats, leg extensions, and leg curls.
Okay, let's see the leg extensions again.
Leg extension would be sitting in the machine like this, and just leg extensions like this in a machine, or you can do these in a chair, or you can do them standing for better balance. Next thing would be to work the chest, push-ups, pull-ups, pull-downs, military presses, curls, and triceps. Those are the basic movements for the basic groups in the body. And if that was accomplished and done at least 3 times a week, you would have basic fitness as far as strength is concerned. Then there's cardio. Just do something you like. Walking is probably best. Biking, stationary biking, inside or out. Treadmill is also fine. But if you can get these activities in at least twice a week for the cardio and 3 times for the resistance training, you'll have the basics necessary to be able to help out in an emergency. That's all I've got. David, anything else?
How hard should they push themselves in the beginning, and how fast should they try to increase their ability?
I think it depends on who you are. I'm 64 years old, but I've been training for my entire life. So if you want to start these very basics, for example, a squat, you can simply sit into a chair and get up out of a chair 10 times in a row. If you want to go all the way down with weights and go all the way down into a squat like that, perfectly fine, or any gradient on that point. So I would start very, very slow so you don't get too sore or run the risk of injury, and then gradually add a gradient, bring it up. Or you can call David and we can be communication and give you specific recommendations.
All right, and then how fast should they try to move it up? When you say small gradient, and you're talking, they start with 10 push-ups in a week. Should they be at 11 or at 15 or?
Well, I mean, if somebody can do 20 push-ups without stopping in relatively good form, that's a very good baseline, I think, for men. Women can be doing push-ups, for example, against a table like this. You can be doing like this, or with the legs bent like this to increase strength. Men should be able to do a push-up. If you get to 20, that's adequate. If you want to take it to 50, to 100, that's totally up to you. It's a level of fitness you want to try to accomplish for yourself. These are the basics.
All righty, and then in terms of saying that somebody our age is physically fit, could you put a number on how many sit-ups, push-ups, squats? And I don't think that we did any of the crunches.
I can demonstrate that. To work the abdominal muscles, we'll do that first. To do a crunch, again, with the legs bent, see me, David?
Yeah.
Legs bent like this. You want to be able to push your back down against the floor. Push your back down against the floor and do the crunch from here. In a forward position, an oblique position, forward and oblique, with your back forced against the floor. This is safe to do, and by what are called EMG studies will activate the most amount of lower abdominal fibers. We don't want to be doing sit-ups the way we used to do back in gym class, because they're primarily for hip flexors. So if you get your feet on the floor like this and crunch forward, trying to push your back against the floor in one direction, the other direction, we get the obliques and the major abdominal muscles that way.
All right,
That's a good way to get a push-up done.
good. And then how many to have you say, okay, for people our age, how many should they be able to do ideally?
I would work up to 50 and then get to 100.
Okay.
Not that hard to do. When you think about it, if it took seconds, 1 second, 2 seconds, 100 is only 100 seconds. That's only a minute and a half. We should be able to do at least that.
All right.
And same thing with push-ups. Push-ups, again, you're only doing about 1 second per repetition. 25 to 50. This would be easy to do within a minute's time.
Awesome.
Squats, same thing. Squats, you go all the way down, come back up, and that's 1 squat. If you want to make it more difficult, you can take weights, and if you have dumbbells, do it this way also. It's more difficult. And then if you want to work everything at the same time, a nice compound movement would be 2 dumbbells in your hands, doing a squat to a hammer curl, to a military press, to an upright row, to a lateral raise, and back down again. That's 1 repetition. If you can work up to 10 of those with a weight, maybe starting at 5, 10, 15, I do it with 30 pounds. You get all the major muscle groups, and within 2 to 3 minutes, you have an intense, high-intensity interval training workout with that. Very high pulse rate, very high intensity, and you can be accomplished with that. You know, you can get to that type of repetition within probably several weeks. starting with a very low weight to begin with.
All
Little
right.
compound movement.
All right, and then I've heard that rebounder or something like that is a good thing to do, particularly if it's hard to get outdoors, although here in Florida it's usually pretty easy.
Right, well, anything you like, I mean, as far as cardio is concerned, it's nice to be able to do something you like to do. It's very difficult to force yourself to do something you don't like. Walking fast, a light jog, biking, stationary biking inside or biking outside, a rebounder, whatever it takes, or whatever you want to be able to do to get your heart rate up is perfectly fine. And the idea is to do it with intensity at your maximum for maybe about 30 seconds to 60 seconds, rest again, because the interval training will shorten the amount of time. There are people who spend like an hour on the treadmill. It's way too much time and found to be unproductive. So if you just increase the intensity a bit with little breaks in between, high intensity, come back to normal, high intensity, come back to normal, high intensity, come back to normal, within 10 to 15 minutes you'll have a very nice cardiovascular effect with very little time.
Awesome. Thanks so much.
Very good. Good luck.